So we're going to talk about how we do the Sculptra injections. This is done in the office. I've had Sculptra injection done a number of times. First time was done almost 10 years ago. And I would have to say, having had Botox for a number of years, it's less uncomfortable to me personally than all the little sticks from a neuromodulator. But it still can be a daunting task. So I'm going to take you through this technique. It's done after application of a topical anesthetic. We have the material mixed in an injection that has anesthetic in, so you stay pretty numb through the whole process. This is an example of a gentleman who had had a previous facelift. We then did a facelift and fat injection for him. This first facelift was done elsewhere, and so we wanted to restore the elements of his face. He looks great at 1 year postoperatively. You see him 3 years later. The normal process of aging shows loss of volume where he had his fat injections. Now his overall result is still better than his previous picture, but you can see where the volume has been lost. So what we're going to do is plan to restore volume over the entire face. We call this pan-facial injections. In the temporal area where he has had continual loss because of aging, we're going to put this right on top of the bone to support the muscles. Under the eyes, we're going to place this on the bone as well as under the nose to create support for the cheek and the nose through this midface. We're also going to inject on the bone to support the pre-jowl sulcus. The yellow marks are where we're going to be injecting in the deep dermis to give us dermal lipo elevation and support. So with these marks noted, you can see this video. We're going to put 1 syringe worth in the temporal area. As you can see, it's easily tolerated. We're injecting. It's got a very safe effectiveness with this injection. Once we inject this, we move to the midface. We're injecting it just under the eye to give elevation to the cheek. We're now creating the entire cheek mode. This is going into the subcutaneous component. And as you can see, we have created the cheek mound, the triangle of the cheek. Once we've created the cheek, we're going to move our way into the midface. We're now giving support to the nose. You can see this deep fold, the deep smile lines is being supported with injection on the bone just under the nose to give support. We then move to the jawline. We're going to inject on the bone, under the muscles, which then elevates the jowl to diminish the marionette lines. It also gives elevation and support to the corners of the lip. And then as we age, we're losing the angle of our mandible, the jaw. So we're trying to restore the mass and the contours of the cheek with injection into the deep dermal elements. And as you can see from these pictures, it's very well tolerated. So this is after the injection. You're looking at the injected side. You see the elevation, the improvement of the cheeks and the jawline. Now it's going to take up to 3 to 6 months to see the final result, but on the table, this is where we anticipate this improvement to go. So when we look at him, this is going to be 3 years after the Sculptra injection. So he's now 71 years of age, 6 years after the facelift, and 3 years after Sculptra injection. And you can see the beautiful maintenance of this facelift result with the use of Sculptra. There he was before the Sculptra, and here he is after the Sculptra injections.